Hello, this is Dr. Grande. Today's question is, what's the difference between schizotypal personality disorder and schizophrenia? Now, this is an excellent question, and these two disorders are easy to confuse with one another. Schizotypal personality disorder is a cluster A personality disorder in the Diagnostic and Statistical Manual. It's in the same cluster as schizoid and paranoid personality disorders. This is considered the odd eccentric cluster. And schizotypal personality disorder is a pattern of social deficits. Now, schizophrenia is really much more severe, typically, than we'd think of schizotypal personality disorder. And schizophrenia is not a personality disorder. So first, let's take a look at the symptom criteria for schizotypal personality disorder, and then we'll take a look at the symptom criteria for schizophrenia. So schizotypal personality disorder is characterized by a number of potential symptoms, including ideas of reference, odd beliefs or magical thinking, unusual perceptual experiences, odd thinking or speech, paranoid ideation or being suspicious of other people, inappropriate or constricted affect, behavior or appearance that could be described as odd, eccentric, or peculiar, lack of close friends except for possibly first-degree relatives, and social anxiety. Social anxiety that comes about due to paranoia and doesn't diminish with exposure to social situations. Now, if we look at these symptom criteria, we can see that all of these symptoms could be present with schizophrenia. And this is really why these two disorders are difficult to differentiate. Now, when we look at the symptom criteria for schizophrenia, we see there's just 5 criteria: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms like diminished emotional expression and avolition. That's when somebody has a decreased interest in goal-directed behavior. So when we look at these symptom criteria, there seems to be quite a bit of overlap. So what are the differences between these two disorders? How can they be differentiated? Well, first, it's important to note that an individual can have both schizotypal personality disorder and schizophrenia. And usually the way that a clinician would figure this out is schizophrenia tends to run in phases. And when somebody's not in a phase that's symptomatic, there may still be schizotypal personality disorder symptoms there. So that's one way the clinicians can figure out that both might be present. In terms of differences, though, we see that schizophrenia has persistent psychotic episodes, and they tend to be more prolonged, more frequent, and more intense than the brief psychosis we sometimes see with schizotypal personality disorder. Now, I mentioned with schizotypal personality disorder, the first symptom criteria is ideas of reference. These are not held with delusional conviction, meaning somebody can usually be swayed from these beliefs. Otherwise, it would be a delusional reference. And that's what we usually see with schizophrenia, a delusional conviction. So an individual with schizophrenia oftentimes believes the delusions and cannot be swayed from those beliefs. Another symptom criteria I mentioned with schizotypal personality disorder was odd thinking or speech. But this speech would not typically rise to the level of incoherence. With schizophrenia, there could be incoherent speech. So that's another difference. We see a few other differences with schizophrenia as well. Usually with schizophrenia, there is a low amount of motivation, much less than we would typically see with schizotypal personality disorder. Also, usually individuals with schizophrenia have more difficulty in occupational environments, more difficulty working than we see with schizotypal personality disorder. And the social withdrawal that we see with schizotypal personality disorder is usually more severe in schizophrenia. So when we compare schizotypal personality disorder and schizophrenia, a lot of the differences really are around how severe the symptoms are. What type of psychosis, how long are the psychotic episodes, how intense are they? Do we see incoherent speech versus just odd thinking in speech? So a lot of this has to do with the degrees of the symptoms. And whenever you have two disorders that are differentiated largely through how severe symptoms are, it is very easy to confuse those disorders with one another. I hope you found this description of schizotypal personality disorder and schizophrenia to be interesting. Thanks for watching.